Thank you very much. So I'm truly delighted to present on behalf of the APAC Liver Disease Alliance. So this alliance is a multilateral platform unifying diverse stakeholders from various Asia-Pacific countries with a clear mission, that is to reduce the growing burden of liver disease and its social and economic impact in the Asia-Pacific. So we've worked towards raising awareness, strengthening political commitment, and also really helping national efforts towards hepatitis elimination and reduce the liver cancer burden across the Asia-Pacific. So I think everyone here is well aware of the scale of the silent emergency, but just to recap on the death, we're looking in the Asia-Pacific particularly, and we looked that it is really accounting for 63% of the global death toll. But the burden of viral hepatitis is just not measured just by the lives lost, but also looking at the economic impact. And several countries have shown data that it is really a threat to health systems as well as the national productivity. So if you look at what is actually also known is the relationship with liver cancer. So chronic viral hepatitis remains the leading cause of HCC globally. And again, the Asia-Pacific region bears the major burden with a whopping 72% of the total liver cancer death. And equally concerning is that 4 out of 5 cases of liver cancer diagnosed within the Asia-Pacific region are only diagnosed at an advanced stage. So viral hepatitis mortality, looking at monitoring is essential and central to the public health strategies regarding hepatitis elimination. And this forms part of the global impact target, as we've shown earlier, of viral hepatitis elimination. And you can either, really, countries must not just try to achieve this, but also monitor what the death rate is, either directly looking at the national mortality data from viral hepatitis, or indirectly, such as using HCC incidence as a surrogate for liver-related mortality. So what it shows here from these figures is that you need a comprehensive and integrated policy response that address both hepatitis and HCC as a continuum rather than just looking at one separately. So my presentation is based on an updated infographic which has been developed, built on the targeted review of the latest data from these countries, shaped by the input by leading hepatitis and liver cancer experts across the region, and validated by engaging clinicians, researchers, as well as policymakers to ensure that the findings or the infographic is clinically sound and policy relevant. So what is highlighted in the infographic, the updated one, is not just based to capture the progress since 2023, but really is also to drive and sustain momentum around hepatitis elimination and HCC surveillance across APAC, both nationally as well as regionally. So this is shown here is the table on the status of hepatitis elimination across 13 countries within the Asia-Pacific region. And what is shown here, as you can see, that the progress towards elimination within the Asia-Pacific is mixed. The progress is evident in some of the health systems shown here, while others still face major challenges in trying to achieve elimination targets, particularly with regards to funding and the implementation of the full hepatitis elimination efforts. So another thing to take note is that significant new developments or policy improvements that are observed are highlighted by the triangles that's pointing outwards. For example, from Thailand, which has shown not just the presence of a national action plan, but making it stronger with greater funding, and also demonstrating political commitment from many pillars with respect to the hepatitis elimination. However, despite the advances that we've seen across the data from the countries, most, as shown earlier also, of the Asia-Pacific countries are not on track to achieve the hepatitis elimination by the year 2030, underscoring the urgent need for a stronger collective push to eliminate hepatitis as a public health threat in our region. So Australia, Taiwan, and Japan stand out as for the runners in this hepatitis elimination efforts, and they offer not just commendable progress, but also models of best practice and inspiration for the rest of the Asia-Pacific countries. And the success was built on 4 critical foundations: having a robust national action plan, having sufficient and sustained political will and coordination, adequate funding, particularly to implement a well-established screening and treatment programs which are tailored to diverse populations. So these are the 5 key comprehensive and integrated policy response which have been recommended to provide guidance for countries to accelerate progress in this region. I think most of you are very familiar, and most of the national action plans have incorporated at least 4 out of the 5 key recommendations. But what's lacking in many of the countries is really the integration or the lack of initiative to implement and integrate a comprehensive national HCC surveillance program and to ensure timely access to treatment for both hepatitis as well as liver cancer. So definitely, if you look at what are our roles, there are, every stakeholder in the healthcare ecosystem, whether it's government, healthcare providers, healthcare professionals, systems, civil society, or even industry, we all have something unique to offer. But what everyone is looking at is that perhaps we need to align all these contributions, and the data has shown that eliminating viral hepatitis is more than just achieving a public health goal. If everyone works together, it should be looked at that this is a collective investment in healthier communities and more resilient healthcare systems. So I think the messaging is very important if you want to actually really, truly wanting to have political will for the governments. They will always look at outcomes, but there are different things that we have now to emphasize. And sometimes what I feel, at least in Malaysia, that when we actually talk about hepatitis, it's not sexy enough for them to think about it just by itself. But if you look at what everyone is also saying, if you look at the liver cancer data, it's a lot more convincing to show that it is rising. It is rising to the fact that it can create concerns for governments to act, So perhaps this is the time we do this together. So lastly, the 2025 APAC Hepatitis and ACC infographics now live, and it's available in the APAC Liver Disease Alliance website for download, sharing, and advocate. I plead for all of you to join us in putting these recommendations into actions with an ultimate aim of driving regional and national action to reduce the burden of both hepatitis and liver cancer. So I'd like to end by stating that eliminating hepatitis and integrating HCC control is a shared investment where every stakeholder contributes, every community benefits, and healthcare systems emerge stronger. With that, thank you.